Good afternoon, everyone. Today I'm going to do a case presentation on endogenous panophthalmitis in a chronic kidney disease patient. I do not have any financial interest. A 47-year-old male, known case of chronic kidney disease since past 7 years, was on hemodialysis for last 1 month through the tunneled central venous catheter in the right internal jugular vein. The patient presented to our outpatient department with a complaint of sudden painful diminution of vision of right eye since past 2 days. Coming to the history of presenting illness, the patient was apparently normal 2 days back when he started developing sudden painful diminution in right eye associated with redness, purulent discharge and swelling of the lids. History of fever following the last session of hemodialysis 2 days ago was also present. There was no history of trauma and recent ocular surgery. Coming to the visual acuity, in the right eye, the visual acuity was PL positive, and in the left eye, the BCVA was 6/9 and N6 with spectacle correction. On anterior segment evaluation, in the right eye, the lids were edematous, and the IPF was narrow. The conjunctiva showed congestion and chemosis. The cornea was edematous and hazy, with fresh keratotic precipitates lining the corneal endothelium. In the AC, a flare of grade 4 was present, with hypopyon lining in the inferiorly, and the pupil was mid-dilated, round, regular, and sagitally reacting to the light. Coming to the left eye, the anterior segment was within normal limit. On posterior segment evaluation, the right eye showed vitreous flare of grade 4 with rest details not visible, and in the left eye, the fundus was within normal limit. Coming to the general examination, the patient was thin-built and poorly nourished and afebrile at the time of presentation. Pedal edema and swollen hands were present, and the blood pressure was 170 by 90 millimeter mercury with rest vitals within normal limit. Coming to the blood investigation, there was raised WBC with a neutrophilia of 83.5%. The patient was anemic with a hemoglobin of 5.3 gram per deciliter, and the serum urea and creatinine, an inflammatory marker, that is procalcitonin, was raised. On blood culture, Klebsiella species was found positive, and it was sensitive to antibiotics such as amikacin, ceftazidime, gentamicin, imipenem, ofloxacin, and piperacillin and tazobactam. On doing the aqueous swab and urine culture, no growth was found. Coming to the MRI of the orbit, in the right eye, features of endophthalmitis and panophthalmitis spectrum with breach in the sclera and orbital cellulitis was seen. Here in the MRI, we can see that there is heterogeneous signals in the vitreous along with the inflammatory thickening of the extraocular muscles and the preseptal tissue. And there is also deformed structure of the right lobe. Coming to the diagnosis, it is a case of endogenous panophthalmitis secondary to the IgV catheter infection. Coming to the treatment, the patient was started empirically on the intravenous antibiotics along with topical steroids, antibiotics, cycloplegics, and intraocular pressure lowering agents. One dose of intravitreal injection of antibiotic comprising of vancomycin and ceftazidime was also given. However, the condition of the patient deteriorated. As we can see, here is the formation of a scleral abscess, and due to the presence of the scleral breach and orbital cellulitis, the patient was further planned for evisceration with frill excision of sclera of right eye. On follow-up, the other eye was quiet. Coming to my conclusion, the early diagnosis and management in these cases is very important. However, the outcome may be poor in most of the cases requiring evisceration and enucleation. The factors for the better prognosis depends upon the initial visual acuity, the early first visit of the patient, the virulence of the organism, and associated systemic factors, which in this case is the poor renal status of the patient. These are my references. Thank you.
Thank you, Dr. Kalpana. Do we have any questions?
Dr. Kalpana, any case reporting regarding the CKD patients, how many patients and what age group?
Sorry,
What is the age group criteria, that type of CKD patients having a panophthalmitis? Yeah, this is not reportedly so current, na? How many cases you have seen? I am asking about the case report. CKD patients.
CKD patient, ma'am, I've seen numerous, but with the history of endogenous endophthalmitis or panophthalmitis is the only one case I have I've seen. Yes, ma'am. I've not seen any other cases like this.
And what the age group of that patient?
Ma'am, this is 47-year-old ma'am patient.
47
yes,
years
ma'am.
old.
And
The
he's a known
patient
case of CKD since 7 years, and he was receiving hemodialysis for the past 1 month currently.
This is a very rare. Whenever I've also multi-specialty and having a CKD patient, always the dialysis was going on. But last 3 years, I have not seen that of the patients. Very rare. But the only the most of thing, the immunity power is very much less that type of patients.
Yeah.
Okay. And patient having so much dialysis patient, so they have a hepatitis B positive, some are HIV B positive. That means the total plus point is the patient immunity is very much low. And that patient very attentive, that type of patients, and physician consultations, and always you look after the every patient which go through the hemodialysis, always you concentrate on that patient. Okay. So that
Was
may
he on
be-
any immunosuppressive? No.
No, ma'am, he was not on any immunosuppressive.
Okay, because the glucose level is little bit normal, 5.8 now. Glycosylated
ma'am. It
hemoglobin
was
5.8.
pre-diabetic range, ma'am.
That means
Yeah.
the patient having not a diabetic
No, ma'am, he was not a diabetic, ma'am.
criteria.
But he
Okay,
was
thank you.
anemic, ma'am. The
Anemic.
hemoglobin was low, ma'am.
Every patient is anemic,
Yes, ma'am.
I think. Okay, yeah. Thank you.
Thank you, ma'am.
Nice presentation.